Corla. I want to start by paying tribute to all of the workers who are putting their health and their lives on the line in the fight against the coronavirus. Above all, that is everybody who works in the health service. The nurses, the doctors, the porters, the cleaners, the paramedics, the care assistants, the home care workers, and many others. It's also everybody out there who's engaged in essential work. The truck drivers bringing food to our shops, the retail workers, the postal workers, the bin collectors, the pharmacy workers, the bus, Lewis and train drivers bringing all those workers around. The crisis is laying bare many realities about our society. One of those is highlighting those whom are essential workers. People can see in that list there's no CEOs, there's no hedge fund managers, there's no senior bankers. The workers who are doing the essential work in our society on the ground are workers who are invariably substantially underpaid, undervalued, working in sectors that have been underfunded by successive Fianna Fáil and Fine Gael governments. For too long, our health workers have been underpaid and overworked. Their calls for improvement in staffing levels, in hospital conditions, in wages were met with shrugs by the government. Now, when they've been called on, they put their shoulders to the wheel and went beyond the call of duty. The same applies to the massively underpaid defence forces. It applies particularly to student nurses today who need to be paid immediately. And all of this must not be forgotten when the crisis is over. Those workers are added to by all those workers who can't go to work, who are making a huge effort to socially distance to protect themselves, their families and society at large. All the community groups that have been set up to help each other out, to drop food and supplies to older and vulnerable people, to help people who are self-isolating. The very best of solidarity has been brought out in the vast majority of people. Unfortunately, their efforts are being undermined by a small minority, the non-essential companies which are still opening up, the call centres, the factories, the construction sites. Stuff that is non-essential for the running of our society, putting their private profit before public health, endangering the health and lives not only of their workers, but of people in the wider community. I've been inundated by calls in relation to this. A call yesterday from a guy about Heaton's and Sports Direct asking part-time and casual workers to come in and do work. Very evidently non-essential retail work. Mandate has done good work in highlighting it, in protecting the interests of retail workers. It must be shut down. The most blatant has been in the construction sector. And again, I've been inundated talking to a guy yesterday on a major site in Dublin who says, one, it's simply not possible to socially distance on these big sites. Two, there's no hand sanitizer available on the sites. I got a message yesterday from Niall who says, I really feel we construction workers are being thrown under the bus. I travel between 3 or 4 sites a day with a combined workforce of about 1,500 on them. Social distancing is impossible. My wife is working from home, my son is home from school, then I go out all day and bring whatever I've been exposed to back into the house. Please fight for us. People should go on to Unite's Twitter, who've been doing Trojan work in exposing picture after picture of construction sites. The CIF said yesterday that 200,000 people work in construction in this country. If up to half of them became infected, which is a percentage estimated by Paul Reid, and 15% of them came ill, and even if the current mortality rates of 0.6% applied in Ireland, applied to those workers, you're talking about 600 workers who could die as a consequence. That doesn't include the risks to other people that construction workers come into contact with. You can expand that out to factories. I have a message from Ger, a factory worker who says he suffers from asthma, he's living with his parents. My father would be high risk as he's over 60 and has underlying health conditions. He works in a factory that's not essential and will not close unless told to do so. I couldn't live with myself if I got infected and brought it home with me, and God forbid passed it on to my parents. So my query is, can I refuse to go to work? And if I do, would I be eligible for the social welfare payment? We need a clear direction from the government to shut down all non-essential work. It's the only way it'll stop. It's the only way to protect lives and health of those workers and the wider society. If that doesn't happen, well, then workers will be left with no choice but to take similar action to which we've seen in the north, in ABP Meats and in Moy Park, where workers have simply walked out and said we're not prepared to continue to work in these unsafe conditions. We need action and direction from the government now.